Today we start with the next part of how do organisms reproduce. The last part of is human reproduction. Now for humans to reproduce, there should be a maturity level in girls and boys. When these girls and boys mature, their maturity, their body symptoms show that they are gaining maturity. This is the stage when they attain puberty. So at the time of puberty, the maturity of these boys and girls is shown by some symptoms which are thick hair growth takes place in the armpits and in the genital region between the thighs. The thin hair are developed on the legs and the arms. Then the skin becomes a bit oily and they develop pimples. These are some of the symptoms of puberty. Especially in girls, the breast grow, the size of the breast increase. They menstruate. Every month they bleed for 2 to 8 days. And in boys there is thick hair growth on the face and their voice cracks. So these are some of the maturity symptoms in boys and girls. Now when they mature, naturally there are some hormones due to which because of the hormonal changes, these puberty levels are observed in boys and girls. Okay. Now then their reproductive system is well developed, and we are going to consider the male reproductive system and the female reproductive system and how reproduction takes place in case of human beings. Now first we move to the male reproductive system. Now in this male reproductive system, in this diagram you see that there is a testis, means the sperms are the male reproductive organs. Okay, the testis, in this testis the sperms are produced, and these sperms, it is because of the sperms, that is the gametes, the male gametes, why there is reproduction. Now this testis is at the lower part of the body. It is abdominal, temperature is very high, therefore they are present at the lower side of the body where the temperature is low. This testis, it is present in the scrotum, and from the testis these sperms are given out. When these sperms are given out, naturally they are going to be out from the body through the penis, but before that they are passed through a tube which is called the vas deferens. Now when these sperms, they pass through from the testis to the vas deferens, they are moving through a tube where a tube joining from there is from the urinary bladder, means this is become a common duct for the urine and also for the sperms. So the ureter is bringing its urine to the bladder. From the bladder it is coming to this vas deferens, and from the vas deferens the sperms as well as the urine, it is a common duct. From there it is passed out through the penis, that is the urethra. Now there is prostate glands are attached to this particular van deferens, and the seminal vesicles are also attached. These glands, they are giving moisture to the sperms so that they can be fluid, they can easily move. Okay, and they are also responsible for nutrition, means they are giving nutrition and they are giving fluidity to the sperms and the urine. Okay, so this is how the male reproductive system is working. So remember, you have to label the bladder, the prostate gland, the seminal vesicle, these are the two glands. This is the penis through which the sperms and the urine, they are given out. This is the urethra, and the testis, in the testis are stored the sperms, and this is the scrotum where the testis is present. Okay, so this is the male reproductive system. Now moving to the female reproductive system. Now this female reproductive system, you know, it consists of the uterus where the young one grows. When there is a contact between the male and the female, then these sperms, they are passed from the vagina through the cervix into the uterus, and from the uterus they move into the oviduct, which is called the fallopian tube. Now this fallopian tube, here is where the fertilization takes place generally, because the ovary has got ova or the egg. Every month one egg is matured by a girl or a woman. Okay, so these ovary, the egg from the ovary, they pass into the fallopian tube, and from here the sperms are coming. They are coming into the vagina through the cervix, they are moving into the uterus, and when from the uterus, when they move into the oviduct or the fallopian tube, that is, there is the place where fertilization takes place. Fertilization means the coming together of the male gamete and the female gamete, that is the sperms which have a tail, and because of the tail they can easily move from the vagina to the cervix and the uterus. Now once this zygote is formed, it undergoes fragmentation. Okay, and that embryo, it comes into the uterus, and there uterus there is a disc-like structure which is called as the placenta, and with the help of that placenta, the fetus and the mother, they are attached to each other, and this then zygote, it is feeded in the mother's womb, and all the blood, all the oxygen the fetus is taking, it is from the mother's womb. It is from with the help of the placenta. So this is how the female reproductive system is working. Remember, there are hundreds of eggs, but only one is mature every month. Okay, by chance if it happens that there is no fertilization, then every month a lady menstruates, means that is called menstruation, means this thin walled, a thick blood level is formed, blood is there at this particular uterus. It is a spongy area of blood and mucus. Then if fertilization does not take place, then this breaks, and after breaking that bleeding, it comes out of the uterus, the vagina. So this is how menstruation takes place. So you are generally asked, why does menstruation occur? So why menstruation occurs when fertilization will not take place, naturally menstruation will take place. Okay. So the breakdown and the removal of the inner thick soft lining of the uterus in the form of blood and mucus, this removal of blood and mucus every month, it is called as menstruation. Okay, and it occurs when fertilization does not occur. Now menarche, it is the first menstruation, means when a girl is 10 to 12 years old, at that time menstruation takes place. Okay, and that first menstruation, it is called as menarche, and after an age of 45 to 50 years, every lady she stops menstruating, and that stoppage of menstruation, it is called as menopause. So menopause is the permanent stoppage of menstruation. Okay, so you need to know what is menstruation. Then now when the male and female gametes, they come together, they undergo what? Fertilization. Okay, but when there is no need of reproduction, then there are some contraceptive measures each lady or a man can use, and these contraceptive measures, they help in the prevention of reproductive measures. Okay, so these preventive reproductive measures for women are that she can take contraceptive pills, they are hormonal pills which does not allow the fertilization of the embryo. Then the second, she can put a copper T or a coil loop in the uterus so that there is no fertilization. Third, her fallopian tube can be blocked. This is a surgical method, and if the fallopian tube is blocked, again she can go in for an operation. Okay, so that these are the three ways in which she can be contraceptive. And in case of men, they can use condoms, or they can use, there are surgical methods also. If this vas deferens, it is blocked, means with the help of surgery, if it is blocked, naturally the sperms will not move through the penis. So this is how this men can also have different contraceptive measures. Okay, so this is how the human reproductive system works with the help of the male and female reproductive organs. The male reproductive organs, they are the sperms which have tail and which can move. Okay, and the female, it has every month, remember, she has got only one mature egg, and if there is lack of fertilization, then menstruation takes place. Okay, so this is all about the human reproduction in human beings.